I am Matt Greco. I am the events manager here at PSS Life University, and second Thursday of every month, we have Dina D'Alessandro talking on a nutrition topic. She is a registered dietitian, although she's going to say not your registered dietitian. And today, as you can see, her topic is cancer awareness. So thank you for joining us. And with that, I'll hand it over to Dina. Please put any comments you have in the chat. Sometimes at the end, people are free to speak up, but we'll take it as we go.
Yeah, thanks everybody. Hi. If you've seen me here before, I think this marks like 3 years now that I've been doing this every month. So I'm so grateful to always be in wherever you're tuning in from, in your living room, in your community center, at your desktop. Thank you so much for having me. As Matthew said, we're going to be focusing on cancer awareness and prevention. So obviously, when I talk specifically about conditions, I kind of go deep in the heart of a lot of the treatments and the diagnoses, and then the food related things and other habits. So if this feels like a sensitive topic to you and you just need to take a little time for yourself or reflect or whatever, obviously do what you need to do to keep yourself safe and engaged if you want to engage. Going forward here, what we usually do is put some objectives for you. So some of the takeaways we'll share during our conversation today is identifying some of the more common cancers, understanding those factors that can affect your risk or put you more at risk, and especially with the outcomes of how we can do the best we can with what we got, and then also applying some of these strategies to reduce your risk overall and just maintain a good healthy outcome, hopefully as best as you possibly can. Our housekeeping here, as you heard when you were entering in, the session is recorded. As Matthew mentioned, I'm going to keep my eye on the chat box because sometimes I do engage and I ask for feedback, and you can put comments in. You can also wait until the end and we'll have like a formal Q&A, and it doesn't have to be related to today's topic. I'll answer any random question if I can, or I'll look information up for you and report back when I can. These are for your education and information purposes only. Obviously, please make sure you're speaking with your own healthcare providers, making the informed choices and decisions to support your own health. So this is not medical advice, and get clearance before you decide to do anything different with your healthy habits. So if you've never met before, hello, my name is Dina D'Alessandro. I am a registered dietitian / nutritionist. Sometimes those terms are interchangeable. I'm mostly based out of New York City. And as you can see in bullet number 2, I am an adjunct lecturer and the campus nutritionist here, reporting live today from Lehman College in the Bronx. I'm actually, during the fall semester, I'm doing student-patient counseling on Thursdays and Monday afternoons. And then this is my longest day ever. I'm going to teach tonight with my graduate course, and I teach on Mondays with my undergraduate course. I do a lot of other things too. I don't have a very standard traditional job, so if any of the things that you're seeing in front of you give you a bit of a headache, they do for me as well, especially when I come up to tax time, because I do a wide variety of things. I staff health fairs. I am an independent contractor. I didn't say this to Matthew earlier, but I just took on a consultant position with Head Start. So now I'm going to schools to do some monitoring there as well. And I know some of you might have people in your family who are in some of the Head Start programs. So that's exciting for me to take on a new role. And I also, you can't see, but to my left, I have a nutrition student who is observing my patient counseling today, and he's hanging out with me today as I do these webinars too. So I like to supervise and be a preceptor or a mentor to a lot of our nutrition students, and also dietetic interns who will eventually do what I'm doing in their later on years of life when they graduate, get their degrees, and go on for their credentialing. So thank you again for bringing me here today. October is probably best known as Breast Cancer Awareness Month. So you've seen this pink ribbon show up, I'm sure, a lot of times in the past. This is because 1 in 8 women in the US will be diagnosed with breast cancer in their lifetime. So it's possible, again, like I said, maybe you or someone in your family has gone through this or know someone. For us, in my family, this is a very prevalent condition, so I'll talk a little bit more about my experience with that later on. The pink ribbon was first introduced in the 1990s through the Susan G. Komen Foundation. They headed up the New York City Race for the Cure, and now it's become a way to bring awareness to not just the condition, the disease, the diagnosis, but also screening, interventions, and treatments as well to help. Thank goodness that early detection and better treatments are increasing survival rates for anybody with breast cancer. So it's improving. But In addition to, I figured let's go and kind of acknowledge a lot of other cancers. So if you want to, you can put in the chat if you recognize any of the other colors that you see on the screen. So I want to share some more of these ribbons that reflect other types of cancers. So from left to kind of zigzag right, we have dark blue, we have teal, we have yellow, we just saw the pink one, we have this light colored blue one, we have black, and we have purple. So if any of these look familiar to you, feel free to put it in the chat. I'm gonna give you a sec to acknowledge it if you want to enter your answers in, and then I'll advance and I'll share with you what these things mean from left to right. And I'll talk a little bit about them. I mean, there's unfortunately quite a large variety of cancers and also like subcategories of things too. I think I can probably 57 common cancer ribbons, awareness months, etc. So what you see on screen here, left to right, colon, ovarian, bone, breast, prostate, skin, and pancreatic. I just figured I'd pull out a sample of those, but I'll talk a little bit about some of those. So colon cancer, we usually acknowledge the awareness of that cancer in March. That's indicated by the dark blue ribbon there. Also known sometimes as colorectal cancer. This ranks as the third among common cancer diagnoses in the United States, and it's the second leading cause of cancer-related deaths, unfortunately. But the prognosis, as we said just before too, is very optimistic when it's diagnosed in its earlier stages. So this is why we encourage regular screenings, especially if you are known to be at risk for things. And we'll talk a little bit more about risk factors coming up. This next one here, not the ovarian one. Oh, did I want to do the ovarian one? No, I think I want to jump over to prostate cancer. So prostate cancer ribbon is that light blue one, which the awareness month is, we just passed it in September. This is less visible than some other types. And also because if you have a prostate and you are a male, you are probably, statistically speaking, less likely to go to the doctor as often as women do. And you might also be less likely to discuss your diagnoses and or any symptoms that you might be having. So this is again where we really encourage you. We'll talk a little bit more about screenings and testings when that comes up as well, just to make sure that you are keeping yourself safe and detecting anything earlier. Because this is also something that if it's successfully treated earlier, it's a promising survival rate. Skin cancer is quite a variety of skin cancers. That's indicative by the black ribbon there. We acknowledge that in May, but there's also subcategories. So we have something known as melanoma. This affects the cells that give us the melanin, the pigment on our skin. We also have different kinds of cell cancers within that too. So depending on where they are on your skin, whether they're deep into the epidermis, known as squamous cell or basal cell carcinoma, right? Carcinoma, carcinogen, that's cancer causing. And then the oma is the area here, the skin that we're looking at. So sometimes you'll see different kinds of like moles or discolorations on your body that most people who are fair-skinned, people who live closer to like southern exposure, more sun exposure, are more apt to get that. Sometimes these appear as a scab, sometimes they appear as a shiny lesion. So, we like encouraging people, do a little mole patrol every so often. You might not be able to get to all the different parts of your body, but, take a look at your body when you're in the shower, when you're coming out of the shower, get to know how any lumps and bumps, we'll talk a little bit more about that too in the coming slides. You know your body best. You know if something feels irregular to get that checked out. And then the last one I wanted to point out was pancreatic cancer. That's purple. We acknowledge that next month in November. And that is also, that ranks as the third leading cause of cancer-related deaths in the United States. So here's the deal with that. And I'll talk a little bit about genetics in a second. So it's possible that there are genetic predispositions and certain, because these are mutations, right? So genetic disorders. You might not have a family history of these cancers. So, but if you have the ability to get a genetic screening or going for other screenings as well, that you can detect things earlier on. So your family might have the gene, but your family members might not have ever gotten diagnosed with this thing. So again, this is why we encourage those types of screenings and regular exams, etc. For us in our family, I haven't gotten it doesn't matter anymore because I get tested and I go screened all the time. But the genetic mutations in breast cancer, you might have heard, those are known as your BRCA genes. So it's BRCA1 and BRCA2. So if those genes come up in a screening, then again, you're more at risk for that particular cancer. So this is all genetic stuff that's underlying it. But like I said, not just these ribbons that you see in front of you. There's like 57 common cancers and subtypes and subcategories, lung cancer, brain cancer, et cetera, and different kinds of endometrial, internal, external cancers as well. So unfortunately, it could just be the luck of the draw sometimes that you get something that you're not aware of. And it's really hard to figure out how all of this stuff comes up if you're not going for screenings or if you've not been at risk for something. So hopefully today's conversation will put you a little bit more at ease and make you feel a little bit more empowered. Let's talk about what even cancer is. So in a normal human healthy body system, our cells grow, they multiply, they divide, they break off, they become damaged, diseased, die off in a normal process known as apoptosis. They pop off and they excrete. In the cancer causing system here, in our cells, in our tissues, when they start forming tumors and they're not dying off in the proper way of excreting through our body, that's where then they can form masses. Those tumors or those masses can be known as either malignant, meaning cancerous, or benign. Cancerous ones obviously are going to be problematic, but even benign ones, depending on where they're located, like if you have one in your brain or they develop to be quite large, because that's what they do, they kind of feed off the nutrients in your body and they can grow to different sizes. They might also be considered life-threatening, if not cancerous, and they might have to be surgically removed. So just keep an eye out that even if something is benign, doesn't necessarily mean that you're in the clear. Talk to your doctor about what the next steps are for that. If the cancer tumors travel, which they can do, they can pop around and find other places in your body. That's what's known as metastasis. So if you've heard of something that has the cancer has metastasized, it means that it has found its way to a different part of the body and has traveled in that direction there. So I thought this was kind of interesting. I got this off of the National Cancer Institute, I think, online. This is just a prediction of 2025. So you can kind of see on the left-hand side, there's drop-down menus. If you want to check this out online, you can sort it and stuff. But I just thought this was an at-a-glance interesting thing of what they expect to see for this year. And it's all sexes combined, and it's top listed cases versus deaths. And that is because, hopefully you're seeing and finding things early, or the treatments are really successful, and so they're less likely to cause death. So, taking a look that the left-hand side doesn't equal the right-hand side because some of those things, those factors are in play. So again, statistically speaking, in the US, we have, again, if predictions, an estimated 2 million plus new cancer cases and over 600,000 cancer deaths are expected to occur in this year alone. The top ones are skin, as you see there, right? Breast, prostate, etc. On the right-hand side, the death-related ones are lung, colorectal, because again, sometimes those are a little hard to diagnose, or they're misdiagnosed, or they haven't been caught early enough. Since we're in New York, I thought it would be interesting just to share. We come in, not that this is a good statistic, but we come in fourth across the country in cases and deaths out of all states. Number one is California, number two is Florida, number three is Texas. It's possible because we are in bigger metropolitan areas that we have we're more accessible to things that are environmental that could potentially put us more at risk, or just we have a larger population that, again, statistically speaking, per capita, we come out on top on a lot of these things. Some of the top ones for our causes of cancer deaths among males is lung cancer, followed by prostate, and then colorectal. And for females, you have lung, followed by breast, and then colorectal cancer as well. That is, I thought, just adding this thing here. Let's talk a little bit about risk factors. Top ones here listed are what are known carcinogens, meaning they are known to cause cancer. So these are, you've heard me say this a million times if you've come to these webinars: alcohol consumption and smoking tobacco. Actually, not even just smoking. However you ingest tobacco, even secondhand smoke can increase your risk. So again, we'll talk a little bit about how we can absolve some of these things and what some of the warning signs might be, but just knowing that these are your risk factors. I mentioned genetics too. So genetically predisposed to something and or having a family history of something, just being aware of what might be going on behind the scenes there. And then viruses too. So viruses can increase our risk or turn into cancer. So if you remember, we did the liver health webinar a few months ago. We talked about hepatitis and some of the ways that we can get certain viruses. Sometimes we have vaccinations to protect against some of these viruses. Sometimes we do not, but we do have ways to suppress them. Sometimes we can live okay with them. Sometimes they put us at risk. But again, knowing what causes these, or knowing that you're getting screening early and or trying to troubleshoot them is the best. The last thing on here, again, if you know my conversations around body weight, body composition, body image, I try to be really sensitive around this subject, but I do want to acknowledge, as far as the research is concerned, that excessive body percentage of fat. So when we have regular body fat in our body, that helps protect us, our organs, helps with metabolizing our fat soluble vitamins. It helps regulate our temperature. That's one thing, but we have an excessive amount of it. It can increase things like inflammation and put us more at risk for insulin resistance issues and heart disease, diabetes, stroke, and then of course cancer as well. But I also wanted to point out, we don't hear a lot about the underweight part of this, or people with too little body fat on them. So they are also at risk too, especially for things like oral cavity, esophageal, stomach, and lung cancer too. So they're not always out of the clear on either end of the spectrum is really what we're looking at. So I bring this up too, because a lot of times people in larger bodies have bias against them when they go to doctor's office. People in smaller bodies are less likely to get asked about those things, but either end of the spectrum can put people at risk. So we're talking about that body percent of fat on either end. And I'll talk a little bit more about it too in one of the coming slides. Okay, don't get too freaked out by, by this slide. At a glance, like any day given, I probably have half of these going on. Fatigue for sure, pain always, always. Shortness of breath, yes indeed. 4 flights up on my walk up to my apartment, I have to take a nap in between. But when we talk about warning signs, we're talking about patterns and sometimes unexplained things. Like there's no other real reason that something's happening. Here too is where I encourage you, like I said before, like learn about your body, know your body. I bring up my mom in a lot of examples, and she has, from top to bottom, she's always dealing with some condition, symptom, or otherwise. And we just make notes of that. When you start seeing patterns of something, or something feels curious, or like I said, if you can't figure out what the origin was to something, that's just a good time to inquire with your doctor and bring your symptom journal with you. Say, I've been noticing that this happens when I X, or out of nowhere, I started getting these really weird low-grade fevers, and there's no other sign of like infection or anything. So can we just do a test on that? So we're talking about over the course of time, unexplained patterns of things. A few things I wanted to point out. So if persistent pain happens, we talked before about the metastasizing of cancers. So if you're noticing it's on one side and then it's on another side, or it's consistently traveling in some direction, again, just bring that up to your doctor and see if you can get checked for that. Skin changes, I said before, mole patrol, if you notice jagged edges, if you notice discoloration, things that have irregular borders, if anything's growing large or appearing in areas where you're like, that wasn't there before, keeping an eye on things and making note of that too. And then bleeding too, if if you have blood in your stool or blood in your urine, these could be signs of tumors being present in your colon or in your bladder. So again, just bringing that up to your doctor, especially if you don't have a reason for that to happen. Sometimes medications can cause that. Sometimes just general wear and tear can cause that. You might have a popped blood vessel, no big deal. But if you're noticing something a little bit curious, then make sure you're making a note of that as well. Excuse me. Dysphagia, I just wanted to clarify that in case anybody was not aware of what that means. That's just trouble swallowing, chewing, swallowing, and or if you feel like there's something stuck in your throat all the time, that could be indicative of something in the esophagus, tongue, mouth, oral cavity. So again, just bringing that to the attention of your doctor. And then any changes in your bodily functions. If you're noticing you're doing something more or less frequently, like you're constantly constipated or frequent urination, or you're feeling like, there's stuff that's just kind of weird or curious, again, making note of those things, bringing that up to your doctor to check out. So the way that we diagnose and test for cancer is varied, as well as the treatments are going to be, which I'll share with you in the next slide. So depending on your screening, depending on your symptoms, there's no single test that can definitively say yes, but usually there's kind of like a hierarchy of how your doctors might test for or screen for these things. So the first thing is usually going to be the lab test, your blood test. And I like sharing this with all of you too, because, remember when we talk about these diagnoses, I'm trying to share with you what you see on your blood test results. Sometimes they have acronyms or words that the doctor doesn't explain to you. So what is it that you're looking for? In the blood test or urine test, but blood test specifically, you're looking for complete blood count, or the CBC. That's going to test your red blood cells, your white blood cells, your platelets. So those are helpful in diagnosing certain cancers, like especially leukemia. And also even treatment wise, like monitoring and evaluating afterwards of how well your blood is responding to those things too. There could be blood or bone marrow markers as well. So something known as antibodies or immunophenotyping. So again, that language feels a little bit long and scientific, but if your doctor is using language like this, you can understand what they're talking about, hopefully. And then urinalysis, so that could be helpful in diagnosing kidney, bladder, or other rarer types of cancers like in the urethra. So keep an eye on that and see if anything comes up and if you're being sent to, if you have abnormal tests coming back, the next line of the next line of diagnosing or testing could be imaging. So you might be sent for a CT scan where you might be injected with a dye or a contrast material, and that looks inside and sees different like spottings or shadowing effects of what's going on inside your body, showing places where tumors might be if you go through an MRI. Bone scan, right? Bone density, or if something is spreading to your bones, we want to make sure we catch that very quickly. These are sometimes known as hotspots that the doctor or technician can see in the scan, the ultrasound, the sonogram. Regular x-rays sometimes too, where you might go for that too, and they do a part of your body for that too. Next up, we have biopsies. So in most cases, doctors will scrape away some tissues to see if there's something abnormal before they go to the next level. So again, this could be in combination or in step, one first, one second, one third, or they might do this in combination just to sample an abnormal tissue, or they might use a needle to withdraw some of the sample or the fluid. This is also where the endoscope comes into play too. So an endoscopy or a colonoscopy, that's how they're testing and diagnosing what might be inside your GI tract. All right, next up we have the treatment. So, some of the things around here too can be risks and benefits. So I'm going to share with you too a little bit about questions you can ask your doctor if you are going through something, or someone who's close in your circle who's going through something, just so you can be prepared. But starting off here, just like with the testing, you might have a combination of these treatments depending on the stage, the diagnosis, the type of cancer, or the testing that comes up of what it's telling you is abnormal. Chemotherapy and radiation sometimes go hand in hand as a combo that's helping you kill or stop the growth of the cancer cells and other fast-growing cells, because especially in the GI tract, way back when we started talking about gut health, I think about a year and a half ago, I shared with you that the epithelial cells inside your gastrointestinal system turn over every 5 to 7 days. If you compare that to something like your red blood cells, like if you have high cholesterol and your doctor says come back in 3 months, because your red blood cells turn over every 3 or 4 months or so. So this is very quick in your GI tract. So if there is an abnormality or a cancer growth, it's going to quickly divide and multiply and grow and cause a lot of havoc very quickly. So you might need to catch that in the bud and before it gets to be even worse. Some other things like immunotherapy. So unfortunately, when you're killing off the cancerous or the bad cells, you're also probably killing off some of the good ones. So sometimes there's immunotherapy there to help build up that immune system. Just by nature, anyone who's dealing with a cancer diagnosis or treatment is automatically classified as immunocompromised. So even if they get something like a cold, it could take them a really long time to recover for it, or they might be at risk of receiving a disease, an illness, an airborne issue, just because their immune system has been compromised. They can't fight against that. Then we have things like stem cell transplants, I should say, where if you are, again, with any cells that are being destroyed, they kind of like replenish that through different strategies. The surgery down there, much like the biopsy, but in this case, it's going to be a larger, like I'm taking the tumor out of your body because it needs to be removed. So that would be a surgical treatment. And then you might have to recover from that as well. So I'm going to share with you some questions to take with you, again, if this is your situation or someone who's going through, because, I say this all the time. I'm a healthcare provider, and I was my student and I were in a session earlier, and somebody said, "Do you mind if I take notes?" And I was like, "I would love if you take notes." Nobody ever takes notes, and I don't always send everybody a recap of everything or a summary of everything. So, the more you know and you can advocate for yourself as a patient, the better off you are. And then you can also figure out if you need a support team around you in specialties or otherwise. And I'll talk a little bit about that in a second. So some of the questions, if you're going into cancer treatment: what type of stage cancer do I have? what are the benefits and risks? Odds are your doctor's already taking care of this. Like they're not going to put you through something horrible without knowing that there's something good coming out the end of it. But I'll share, I think, I don't know if I said this earlier or if I'll share it coming up, but sometimes there can be like over-diagnosis of something, or there might be a recommendation of going through a treatment just because to be safe when you might not necessarily need it. So we don't want to tax the system like that. So the more questions you can ask, the better. And then you can make an informed decision as to whether you want a second opinion or decide to forego or delay treatment if that's the case. Where are you going for this stuff? Are you going into a hospital? Is it a long-term thing? Is it every single week you have to go to a treatment center? You know, depending on your own life, your life cycle, your lifestyle, do you have to take care of things to put your house in order that you have to make sure while you're away? Do you have to get a van or someone to bring you to and from these treatments? If you are in charge of anything or you're also working, do you have to take time off of work regularly in order to go to these things? So what is the commitment that you have to go through this stuff? The chance of recovery as well. You know, what are my odds? Am I going to be okay? Am I going through all this for no reason? Or is there a nice light at the end of the tunnel that I can kind of feel good about and not stress out too much about? And then usually not for the healthcare providers, we go through monitoring and evaluation phases too. Or, you know, is it successful? Is it working? Same for you. Double check with your doctor. How do we know it's working? Like, what are the things I'm going to know? Because when you're going through some of these treatments in the beginning stages of it, they can be kind of scary. They might make you sick, nauseous, appetite loss, hair falling out. If that's part of the treatment, you don't have to be so worried. You know it's coming. So that's how it's quote unquote working. And you can get some feedback from your doctor as well. In the dietetics world, we have specialists for this. We have subspecialty dietitians known as oncology dietitians. They work within cancer treatment centers, or they work in hospitals, or they work in outpatient settings where they assess a patient's nutritional status, because a lot of this stuff can waste you away. And we don't want you losing muscle. And again, that unexplained body weight changes, in this case, it would be explained, but we don't want you wasting away. So we want to make sure that you're getting enough protein and you're getting enough calories. And because of some of the side effects of this stuff, it might be hard to eat, drink, swallow, etc. So we want to make sure that you can heal and or decide if you need to be put on any supplements too while you're going through these processes, because your body might not be able to do what it needs to do in its more regular form. All right, you know, I like to discuss myths and misinformation between Google and ChatGPT and YouTube. I do more damage control in this profession than I think I've ever done before. So I'm going to share with you some things that I've heard, some of the top 3 things that I've heard, and just clarify that. Okay, so we talked about this, I think, too, in the liver discussion about, like, you know, excessive consumption of fruits. Everybody's so worried about sugar consumption. Sugar in general comes from carbohydrates. And yes, there's, you know, good quality sugars and not so great quality sugars when you talk about sweetened beverages or cakes and all the fun things. Does it feed cancer? No. Your body's nutrients in general are causing your cells to react and to grow, but it doesn't necessarily mean if you starve yourself from sugar or you stop eating carbohydrates that you're going to reduce the cancer cells or reduce the risk of cancer. There's no research that says that. So just be conscientious again of, you know, obviously if you're making mindful choices, that's wonderful, but don't be too afraid of certain things because you think it's going to cause something or increase your risk of something happening when there's no evidence base around that. Organic foods prevent cancer? Not necessarily. I will say the study that I saw from 2018, the only thing it mentioned was the the participants who ate organic foods more regularly and who ate more conventional foods more regularly. They did have the organic group had 25% fewer cancers in a longitudinal aspect, like as they found them over the course of time and tracked them. But I feel like, again, it's a little hard to, there were limitations to the study. It's hard to really keep track of all that stuff because there's environmental factors. Sometimes it's the luck of the draw. You could do all the quote unquote right things and still end up with cancer or different conditions. Also, I want to share a little quote that I pulled from a couple of things that I pulled from the study. The one thing, because organic foods usually have to do with the pesticides, right? Toxic chemicals that are used to prevent pest and rot from happening for our produce items. So it's hard to test those residue levels. It's hard to see like what actually sticks onto something or how deep it gets into, penetrates the skin of or the cell wall of a fruit or a produce item. A lot of times we peel things off. A lot of times we shed off the outer layers before we eat things. So it might not even be a factor whether you're doing organic or conventional. And assessing food intake overall, because again, how much of too much or how little of anything, where's the threshold? It's hard to really quantify those things. So the words that they used in the study were assessing organic food intake is quote unquote notoriously difficult. So when you hear things or you see things online, and this is a study that did this, or we followed 50 people over the course of 10 years, again, you got to take these things with a bit of a grain of salt because they're not always exactly perfect. And it's just kind of like, a correlation, but not a causation, meaning things can occur, but are they directly related to each other? We don't know for sure. The last thing on here, so wasn't it last month, I think we did the food nutrition food label reading. So you might have heard me talking about the marketing terms like superfoods. There's no real official definition of that. I think people apply that to vibrantly colored, nutrient dense, quality plant items, the things that are, we're going to show you in a few slides coming up, the things that are going to support your health and protect your cells with the antioxidants, high levels of desirable quality nutrition. So doesn't mean that's going to cure. So please don't think I'm going to eat a bunch of broccoli and my cancer will be gone. My friends, you probably need, conventional treatments for that stuff. So please make sure that you're talking to your doctors and finding out other forms of treatment, and you're not just relying on cruciferous vegetables to do the trick. And on that note, I want to also give a nod. I like bringing this conversation up in every webinar. The social determinants of health, especially in New York City, such a wide variety of populations and different kinds of neighborhoods and access to things and financial levels and so on. The individual person is not always responsible for the outcomes of their health. We're talking about what is invested in your community. Do you have access to safe and quality housing? Do you have access to quality and healthy food? Do you have education available to you so you can learn what to do, what not to do, and understand a little bit more of the conversations that take place around health and other aspects of your life? Do you have access to health insurance, patient care, a hospital, a center nearby that gives you the quality that you need, sits down and talk to you, offers you low cost, no cost, or other options for screenings, diagnosis, and exams. So all of those things are also part of our factors that determine our health. Like I said before, you can eat all of the great fruits and vegetables and do everything right, but if you don't have some of the other things that support you and your life, a lot of things are not going to make a big difference. So we're talking about in certain areas, especially New York City, but across the country too, we notice higher cancer mortality, death rates in certain areas that are underserved or on the poverty level. And again, I believe it's a more systemic conversation, addressing those inequities, finding ways to hopefully fund or increase programming regarding health education, communities, policies and action, and then also access to care. So I always like to just acknowledge that it's not always you and your fault for whatever happens in your health. We want to make sure it's a whole team and things that are going on that help support you, and hopefully get you to the outcomes that you want to have. So I'm going to break down in the coming slides screenings and early detection, kind of like a higher level view. Obviously, I know our community here on this webinar, we are older adults, but you might have grandchildren and children who are in these different age ranges. So just keeping an eye out or sharing with them some of the things to be aware of. Usually in your 20s and 30s, this is where you come out of your pediatric life. You're not going to the pediatrician anymore. You're going to your own doctors probably, and you're going for your physical exams. Just keeping an eye out that if you and having conversations with your healthcare providers, if you are more at risk or more than average risk for things like colon, breast, and cervical cancer, this is the time to have those discussions. It's possible you might not need any testing, or your doctor might say, we really encourage every 2 years, every year, every 5 years that you go for this screening or this testing here, just to make sure you're keeping on recognizing detection if something does pop up. In your 40s, these screenings now are similar to the ones that I just showed you, with the exception of prostate. Now, usually in the men's, anybody with a prostate now is going to want to discuss with their doctor, am I at risk? Have those conversations. When should I be tested, or when should I go for my screenings? For women, usually around 45 years old now, we start saying, have a mammogram every year, but we also talk about pros and cons and risks and benefits with getting tested or being in an x-ray machine. So having those conversations with your doctor too, of what the benefits and the risks might be out there. The uncertainties, the potential benefits, I was looking at some of the stuff that possibly comes up with either overdiagnosing or misdiagnosing, or as I mentioned earlier, offering treatment just to be on the safe side when you don't necessarily need that, or it could signal false positive. So you might want to get a second opinion. So making sure, again, you're checking with your doctor, family history of things like this, talking with people that you're related to and find out what their path was, what they went through, and get some feedback from them as well. In your 50s and your 60s, again, you can see everything here. And now we added in lung. So, you know me, right? I've talked about this before. I used to be a former smoker, very hard to give up. And I mentioned in the previous slide too, it's carcinogenic. There's no reason why I should be doing it, but it's a very, very hard habit to break. So if you have been a former smoker or currently smoking, somewhere in the average of about a pack a day, so it's 20 cigarettes per day for at least, many years, this is around the area that you should start asking to go for a lung cancer screening just to make sure there's no damage. Now, obviously, I might encourage earlier, depending on if you started in your 20s or in your teens, the damage could be significant. Your lungs are hardy though, my friends. Your lungs are hardy. You can bounce back from stuff. So if there is some damage and you stop smoking, they are self-repairing. It takes a while, but they can help and get back to normal. So again, with any of these things, having those conversations, making sure you're not getting anything unnecessary, but if you're curious or concerned, you're having with your doctors. I wanted to mention here too, because I don't know, I think I've shared breast cancer, I said before, runs in my family too. I'm at high risk because of that. I've had some abnormal mammograms come back and dense breast tissue issues, so I've had to go for different versions of imaging. I thought one of them was covered by insurance. And about 4 weeks ago, I got a $350 bill that I'm responsible for. So again, just because we're encouraging you to get screened, to go for testing, to go for these exams, just always ask up front or check with your insurance company too. When it comes to breast cancer, I have found my insurance company is like, we don't deem that medically necessary. So you didn't have to do that. But yet the doctor and the lab said I was at risk and I was a candidate for getting that testing. So for me, the $350 is worth it, but it's a bit of a hit, I have to say. So making sure what to expect if and when you are getting tested, whether it's time or finances. 65 and above, this is usually when Medicare kicks in. So again, you can see some of the things here too, because if you have already been going through screenings and testings, and if you had cancer and you are on a maintenance plan, just double check, because sometimes they'll say up through the age of 75, we continue these testings, and after that, usually the risk is worn off if you're coming back clear over and over and you don't necessarily need to go back for these screenings anymore. You can kind of cut it off. So just knowing what to expect in the later years of life and what is or is not covered by your insurance if you have insurance, especially if you okay. General recommendations. So now we're getting to my whole healthy habits and all the things that I want to share with you of. Listen, there's nothing here that we haven't talked about before, right? Stop smoking and drinking, easier said than done. I said that already, but there's no safe forms of any of these things. Even a little bit can affect you and put you more at risk. For smoking, I went through 311. It was a free program, tobacco cessation in the city. It was fantastic. They gave me the patch, they gave me the gum, they gave me a guy that talked me out of triggers and things like that. And it was very, very helpful. The current guidance for alcohol consumption, I've said this in past webinars as well. If you've never drunk, don't start. If you are a drinker, try to stop or try to reduce significantly. It's moderation, we say once a day or whatever. We see things like the Mediterranean diet, which is like, hey, have a glass of wine. But really, when you look at the global research about this, the many, many decades of research, even a little bit can put you at risk. So if you do have family history, if you have had cancer before, I would say, it's up to you what you want to do with your life, but I would encourage you to lay off of all that stuff. Okay, the weight discussion. So going back to what I said earlier with the body fat percentage, muscle mass, body composition, we talked about that in our Science of Weight webinar, I think back in February, that when you stand on a scale, there's a bunch of stuff going on underneath it. The real rule here is more about what is considered a healthy weight for you. So even if you have an excess amount of body percentage fat, percentage of body fat. If your labs are coming back normal and you've always kind of been in a bigger body and that's just your normal, I would say that's better than losing and gaining, because that is what is known as weight cycling. That puts us in an inflammatory state. That increases our risk of what's known as metabolic syndrome. And then there's a lot of damage that comes along with that too. So I would rather you go slow and steady and be at a normal, what feels good for you, a healthy weight for you, and just stay there as best as you can. Or if you are planning specifically to lose, but I guess to gain too, if you needed to gain weight, like I said before, even underweight could be risk factors. There could be a sweet spot, like a therapeutic spot in there. So you don't have to think of, oh, I need to lose X amount of weight or gain X amount of weight. Think about 5 to 10%. That can get you out of the danger zone therapeutically. That's what's known as a therapeutic body weight adjustment. Okay, the next one, moving what you can. I know sometimes as we age too, we have some physical limitations, mobility issues, doing what you can with what you got. Getting that heart rate up or keeping those muscles moving, whether you're working with a physical therapist or you have at-home exercises, or if you tend to be an active person, how can you continue being active? Can you get that heart rate up, the oxygen flowing, the blood moving? That's going to help reduce your risk as well. And then last but not least, my area of expertise, eating healthy. We've talked about what that means as diversifying your diet. Get a well-balanced meal, get a little bit of everything to help support your immune system because your gut is in control of all the things. And that also can provide you with what we said before, those cellular protective properties that a lot of those really good nuts foods have. So diversifying the diet, focusing on as many whole foods as possible, protein, fiber, hydration be in there as well. So let me share with you some pictures because I like images better than words sometimes. So one of the things I always say is eat the rainbow, right? That's a good way to consider it. Even if you're a picky person or you have like taste aversions to certain things or you can't afford certain things, there's probably stuff you can mix and match. You can get frozen fruits, you can get berries, you can get nuts when they're on sale, seeds, etc. Like mixing and match a few things at a time, getting those really good quality vitamins and nutrients in, cruciferous vegetables, broccoli, etc. Those are things that are going to help protect our cells from damage and hopefully decrease our risk of cancer. Fiber, whole grains. Fiber doesn't only have to be leafy greens. You can get fiber from pretty much any plant product. Beans, legumes, lentils are usually on the higher end. Obviously, I know they make you a little bit bloated or gassy, but there's some workarounds with that. You can drain them and soak them and rinse them off or chop them up and make them a little bit more easily digestible. Think of, and by the way, I want to also say too, you don't have to get rid of like your white rice. Like if that's a culturally appropriate food for your traditional meals, enjoy that. But what can you add to your diet that is fibrous? As a nation, we don't get enough. So think of where whole grains come in: brown rice, corn, quinoa. As I said, any of your beans and legumes family, your leafy greens, your plant products, etc. Fruits and vegetables that you can eat with the skin on, potatoes with the skin, an apple with the skin. There's little bits in fiber in that too, and a little bit goes a long way with all that stuff. When you increase your fiber, be sure to also increase your hydration. Otherwise, you will be constipated, and we don't want that. But this really helps with so many different things. It helps support overall gut health. It helps keep us fuller longer. It helps slow the digestion. It helps keep us regular. It helps with also maintaining and managing our insulin levels as well. So this can be helpful for somebody managing or reducing the risk of diabetes, giving us long-lasting energy, and lowers, again, the risk of our cancer risks. Healthy fats, so good quality fats. I'm going to talk also too about limiting or reducing any of those heavily processed meats or red meats, like saturated fat that is found in those things. Limit that to about maybe once a week. Things like bacon and sausages, cold cuts too, like specific cold cuts that are highly processed, not just like a chicken breast that's sliced thin, but those processed ones that you see in the cold cut section. And adding in, if you can, different kinds of fishes, especially salmon and tuna. Those are known as fatty fish, meaning you get a lot more healthy fats in them, gram for gram, fillet per fillet, than you would with something like a cod or a halibut. Walnuts, avocados, olive oils, these are anti-inflammatory properties. If you remember, we did an inflammation webinar not too long ago too, where chronic inflammation can really, mess with our cells and put our body at risk for a variety of different conditions, including cancer. So hopefully this, anything takeaways wise that you think where you might want to add something in versus where you need to subtract something. and helping you create your meal plans for going forward. All right, support comes in a variety of different ways. So one of the things I do in one of my classes, we do case studies, which is like a fictional patient that we discuss with the students. And one of the people that we worked on this semester was somebody who was dealing with breast cancer, and not only with the treatment and nutrition and stuff, but also like, going through some just the condition itself. It's very fatiguing. She might also have pain because it's lymph nodes and, tissue removal and going back and forth all the time. So it might be painful. So how is this person even able to chop and slice and meal prep? They might not be. So if you are working with or know somebody who is dealing with cancer diagnosis, going through treatment, check in on them, see if you can help them out with some way, send a meal service over or prepare some things for them. There's also a financial strain too. Like I said before, maybe some things are out of pocket, or you might have to take off work or coordinate with somebody to do some things at home because you're not going to be able to feel comfortable doing those things. So you might have to pay for a house cleaning service because you're going to need to recover and take care of yourself. So see where you can get some support from your social circles, and also inquire if there's other professional guidance that you need, whether it's specialists for recovery and treatment or behavioral therapy, right? That's a lot of stuff. Like you might feel isolated or stressed out or scared, and however it is that you can support yourself or someone else through this condition and this process. I didn't put all of the resources and organizations on this slide, but here's just an example of a few things that you can go to if you want to Google these organizations and find out a little bit more. More common: American Cancer Society, Livestrong, mentioned Susan Comer earlier with the pink ribbon, and then the National Cancer Institutes, that's the government National Institutes of Health offshoot. But then there's also some subspecialty ones, like there is a Colorectal Cancer Alliance. .org, usually there's a .org or .gov. There's also local cancer screening, so check with your community programs, your community health centers, see what they're offering. Sometimes they have like a mammogram van that just goes around and they, say sign up and come for free. So see what's being offered that you can take advantage of, or share that information with people in your life that you think might be in need of some of this support and this guidance. We are almost at the end of our discussion, our webinar today. I always like to say, what's your takeaways, friends? What do you feel like you want to start, keep, or stop doing? Do you feel like you're on the right path? Are there people in your life you want to encourage to inform them? Maybe they start going to screenings or tests or check something out that, felt a little curious. I had this lump over here and it's been there for a while. Maybe I should go to my doctor and get that checked out. Are there things you're already doing? Like you're including those great colorful fruits and vegetables in your diet. And is there anything you want to stop doing, like smoking cigarettes or anything else that you think no longer serves you? Make a little plan for yourself. We're coming up on the end of the year, and holiday season is upon us, and sometimes we get a little bit off the rails and then we feel like we need to course correct in January. And I encourage you to start today. Start today thinking about what the future you looks like and what is it that you can do to support your overall health. But I also want to advance the slide because I'm giving much props. I want to give a lot of credit to the researchers, the organizations, the programs, the schools, the policies, the fundings that go into everything that I can retrieve and share with you when I do these webinars. So I'm very grateful to all of these researchers, participants, and the powers that be that make this possible for me to do. So thanks, everybody. Any questions, comments, feedback that you want to put in the chat, or open your mics up?
A quiet group today.
I know.
Bettina, I do have a question.
Yeah.
What if you already have cancer in terms of what your diet should be? Is that something that might be unique for depending on the type of cancer you have?
It could be. So all right, so for instance, I was talking about the GI tract, and I've mentioned some of this in previous conversations around the GI tract. If you've had something like esophageal or stomach or cancer along the colon, because if it's surgical or it's been treated in some way and there's damage, or there's something that's been removed from the GI, that can affect what are known as your sites of absorption. So the only changes there could be either an increase in a particular vitamin and mineral, or a supplementation because you can't get what you need out of food. So if you have something removed, like you've taken a section out of your, small intestine or your stomach or whatever, there are areas in there that perform functions that you may not longer have. So that might be a true treatment plan that you have to talk to your dietitian or your doctor with, like, I need to supplement with something because my body's not going to be able to process it. Otherwise, most of the other stuff, I would say, general rules apply, with the exception maybe of breast cancer and soy-based products, because I keep coming across conflicting information, changing information. Soy, tofu, edamame, that whole plant world sometimes is shown to be like reducing the risk of breast cancer in particular, but there are phytoestrogens in that plant product. So if you have it or are at risk for it, sometimes the guideline is be careful or cautious of your tofu or your soy-based consumption. So again, that might be a very specific ingredient or food group that I might have to just assess and say, is this related to this? And let's take a look and let's look at the current research on it, how much of too much, or let's cut it out completely and figure out what are you missing from those foods that we can get in other foods instead.
Right, very good. Okay, well, this was a sobering, very informative discussion, and thank you for that. Positive at
Yeah.
the same time, especially looking at that chart of number of cancers compared to
Yeah.
deaths.
Yeah, yeah, exactly. I was gonna say, I had printed out, it was probably 2 pages of a grid of all of the ribbons and all of the awareness, and it's just overwhelming, like how specific. So obviously, we talk about the more common ones, but there's rare ones, and every nook and cranny of your body potentially could be affected. But hopefully, what we do and the powers that be around us that help reduce the risk of it, hopefully, we reduce our risk of that too. So thank you, everybody.